Welcome to New Look New Life Surgical Arts. My name is Jeanette, and I'm the practice manager and surgical coordinator here at the clinic.
And I'm Josh. I'm our CSO, and I'm also our compliance officer here at the practice. We're really excited to be giving you an OR tour today. We're going to be going over the operating room along with a few other spaces, just so you can get a sense of what it's like to come in on the day of surgery. Jeanette's going to first start off by showing you our intake room.
Follow me. Here we are in the intake room. Our patients arrive and they're brought here to have their vitals taken, their gowns are placed on, and fluids are being given. Our anesthesiologist, our nurse, and our doctor will all come here to meet with you. Our anesthesiologist will go over your medical history, make sure that all the medications are reviewed prior to surgery. The doctor will review the surgical plan, make the markings, and our nurse will go ahead and they'll escort you into the operating room. Follow me. This is our semi-sterile space. I'll go ahead and lead you into the operating room. Here we are in our OR. We have a fully accredited AAAHC facility. Our OR is stocked with everything you will need for surgery, from medications to tools to accessories. We go ahead and we walk over to here where we have some of our technology in the facility. We have the Renuvion, we do have the Micro-Air right behind us on the right, and then we do also have Vaser. We have a couple of other technologies that are not in the operating room right now because we don't need them for this upcoming surgery, but we do have all the state-of-the-art facility things that we do here at the clinic. Our anesthesia corner, our anesthesiologists always review your medications prior to having any kind of surgeries. Our doctors go through a triple check process where your doctors are going through your medical history. The nurses are also going ahead and check off everything that we have spoken about both before and during your pre-op. And we go ahead and make sure that everything is nice and readily available. So when we go over to our corner here, we do see that we have our sterilization room. Hi, Josh.
Hi. Wasn't the OR amazing? We're now in our sterilization room. This is where we take all of our tools after surgery and we clean them in our autoclave. This is the same standard that you've seen in ambulatory care or even a large hospital. We do follow AAAHC accredited rules and guidelines along with EDAC and now WELL AP. Now I'm going to show you our nursing station and our PACU. This is where patients go after they're recovering from their procedures. So after you're out of the OR, a nurse is going to be sitting here, and you are going to be laying right over there. So now we're in the PACU. This is where our pain management experts take care of you. They make sure that you're comfortable. They give you a personalized cocktail to make sure that you are at your best while you're recovering and also while you're on your way home. Now, after you're done with your recovery, you're then discharged, where you get to see your loved ones out in the lobby. Now, let's go meet up with Jeanette.
Hi again. Thank you so much for joining us today on our tour. If you have any questions or would love to make a consultation, just give us a call. We look forward to meeting you soon.
Bye.